Whether you're a parent navigating myofunctional disorders or simply curious about optimizing your family's health, the Biohacker podcast is your guide. Hi, I'm Karindy Ong, a speech-language pathologist, myofunctional therapist, and mom on a mission to bring holistic health to you and your family. Together, we'll explore whole-body connections and integrative solutions. Please subscribe and leave us a 5-star review to help other families discover this podcast. Visit myohackerslp.com for free guides and access to my online community and courses. Content shared in this podcast is for informational and entertainment purposes only. The views and opinions expressed by the host and guests do not necessarily reflect those of the podcast or its affiliates. This podcast does not provide medical, legal, or professional advice. Before we dive into today's episode, I want to share something that has been amazing for me. And honestly, I think it could be for you too. If you've been around for a while, you know I have ADHD. Finding ways to support my focus and mental clarity is non-negotiable. That's why I'm obsessed with Danger Coffee. Unlike regular coffee that sometimes leaves me foggy and jittery, Danger Coffee is tested and proven mold-free. That means no hidden toxins hijacking my brain power. Instead, I get the clean energy boost I need without the crash. But here's the kicker. It's more than just a clean coffee. Danger Coffee is electrolyte rich, which means it supports my adrenal health instead of depleting it. Plus, it's remineralized, which supports cellular function and even the mineral density of our teeth. As a myofunctional therapist, you know I'm always thinking about oral health. Minerals are key to keeping our teeth strong. So, if you're looking for a coffee upgrade, give Danger Coffee a try. And because you're part of the Biohacker community, you can save 10% with the code MyoHacker. Just head on over to dangercoffee.com and use the code MyoHacker at checkout. Try it out and let me know if you feel the danger edge. Now, let's dive into today's episode. All right, guys, I'm so excited. Today I have with us Allison Massengale. She is my best friend extraordinaire from the time we were 5 years old. And Allison, I think you should tell everyone what you told your mom after the first time we had a play date.
Karindy came over to my house and was running around on all fours. And when she left, I told my mom, she's too wild. She's too wild. But then she grew on me and I just love her so much. And she's the best.
So everyone, if you agree, I'm too wild, hear that. I will grow on you. And just stick around and you'll be here for the fun. Yes. So we are talking today about ways that we can support our immune system from a myofunctional and airway standpoint and perspective. So I actually want to ask Allison, because you guys now know it can be a little bit of a deluge of information from me at times. So we wanted to chat about this back and forth because through texts and through calls, just for both of us being moms and having kids that do get sick and having friends that do get sick, we have exchanged a lot of information about what you can do from, like I said, a myofunctional airway standpoint. And I want to ask Allison, okay, what are the big hitters as far as information that I've shared with you that you're like, I didn't know this, or this has been a game changer, and let's go through that. And then whatever we kind of don't touch in those points, then I'm going to jump in and add on more things that you guys can be aware of at the end.
Yes. Well, for sure, the saline spray, that's a huge one. And I loved your suggestions about playing with your kids to get them excited about doing it themselves. Because I know the spray, when you use it in your nose as a kid, it's shocking a little bit, right? So I used a bottle that I had used a little bit, so it wasn't quite so strong with my youngest daughter who's 6. And then I let her spray it in her hand, like you said, and kind of just play with it a little bit to kind of feel how wet it was going to be, and just doing that. And that has really helped. And I know that just the saline in your sinuses is such a big impact on your sinuses. So we've done that for sure. Gargling with salt water, and you hear people talk about gargling with salt water, and it's like, okay, well, you could do that all day long. And I remember you telling me you should only do that 2 times a day. I don't know why you said that, though. I would love to hear what the reasoning is.
Well, okay, so you can do it more. The thing is, we do have an oral microbiome. We have a nasal microbiome. We have a pharyngeal microbiome. The lining of or the mucosal lining within the pharynx, which is just, if you put together the mouth, the nasal passages, and then the back of the throat, all the way down. That all has lining, and it's different in sort of these different areas that we're talking about, but they all have their own beneficial gut, or not gut bugs, beneficial bugs, where we're used to saying gut bugs and things that are in the stomach, but it's this bacteria, and I won't even say just bacteria, because there's other stuff that is all there that is alive. And if we are going in and we're making this a very sterile environment all the time, for one thing, we change the pH. And this is something, the enzymes that we have in our saliva, that is very protective, and that is beneficial for our body as far as protecting our teeth and protecting the microbiome of the mouth. And so if we are gargling all the time, this does help with reducing the bad guys that are starting to populate in there. But you can also then start to knock down the good guys. So if you're like, you know what, we've got strep, we've got something that is, we really want to knock this out. We're doing iodine, which we're going to talk about in a little bit. And we're doing colloidal silver, which I know that can be, a little bit, people go back and forth on that. But we can, if you're doing all of these things that are amazing and killing all the bad guys, guess what? It can also reduce that population of the beneficial bacteria. So that is where, if you're going to gargle a bunch of times a day, which sometimes, depending on the acuteness, you also want to make sure you've got on hand really beneficial probiotics. So yes, eating fermented foods, that's going to be huge. Drinking fermented foods, that's going to be fabulous. And, things like kefir, kombucha, all of that. Again, be mindful. The kombucha is going to be more acidic and changes that some. But when we are reducing the bad guys through gargling, through whatever interventions, this is one of the reasons like a mouthwash can be so toxic for your body, is you are destroying the good guys, that we want to make sure we are able to generate really healthy bacteria through, like I said, the probiotics, what you're eating, all of those things. Same goes with oil pulling, which is fabulous. Okay, it is a great practice and we love it. But if you're doing it so much that, again, you're starting to reduce the body's ability to let those beneficial guys populate in there, then you start to run this balance of how much is beneficial, how much is not. Thankfully, with kids, they're going to limit you on how much you can do all of these things.
Right.
So for the most part, kids actually don't run into too many issues with like overdoing these interventions. Where I see the problems are with adults. Right. So I think that was when it came in. I was like, well, be careful for yourself, because this is how we can, we are overzealous and we can do it too much.
Yes, okay. We're like, I'm going to knock this sore throat out. Yes.
Exactly. Which, okay, since we're talking about sore throats, I know I'm jumping in a little bit, but I want to show everybody circumlaryngeal massage. Okay, this is something that's very beneficial. All right, so this I learned back in my hospital days. And guys, if you're not watching, I will post this one on YouTube so everybody can see. Circumlaryngeal massage is so beneficial if you have tension. Let's say you've been coughing, clearing your throat a lot, and what happens, the muscles around the larynx, which is your voice box, they get tight, and they start to really elevate. They pull up. It can be very therapeutic to do a massage around those muscles. So I actually won't show the full thing that I do where we palpate and move the hyoid, because that is a bone. We don't want to dislodge it. That is something to see an actual therapist to do or about. But what you can do is you can feel that bone. So what you do is kind of find, if you're listening, okay, so what you're going to do is put your fingertips under your chin and you're going to pull back. And right now you're under your chin pulling back. Think like, okay, I'm trying to make myself look like I have no double chin. I'm just pulling it back all the way back. And then, and then we go, okay, found my neck. Now you found your neck. Okay, that is about where your hyoid bone is going to be. Okay, I don't want you to be messing with that specifically. Instead, we're going to go out to the side. So now think you're almost like framing right underneath the corners of your jaw, or the angle of the mandible, or the angle of the ramus, whatever you want to call this. So over kind of under your ears, the sides of your neck, below your jaw. What I'm going to have you do is just gently do 3 circles. So we're going to go 1, 2, 3, and we're going to pull down. Again, I'm going to go more toward midline. So we were kind of out to the sides. Now we're going a little bit more in. 1, 2, 3, pull down. And then I'm going to go more in, going in toward the chin, pulling down like this.
So that last one was just kind of right underneath your chin, going straight down the front of your neck.
Oh, yes. Thank you. I sort of forgot to keep describing. Yeah. Again, guys, this is why you need to have a bestie like Allison who knows your strengths, knows your weaknesses, and is able to like jump in and help. That's exactly what we all need.
We're here for each other. Yes.
Yes. Okay. So
what does that do?
So that helps when we're coughing, we're doing all these things, the muscles will tighten and they will basically go higher. They're going to really pull up, and that you'll feel your tension in your voice like that. It kind of sounds like this. That's hard to listen to. Okay. I know I got a little stressed hearing that. Has that same effect on those around you, has that same effect on your own nervous system. So when we help those muscles to actually relax and lengthen, then that gives us a lot of input to the larynx itself, but also the vagus nerve. Okay. So I'm sure a lot of people have heard about the vagus nerve. It gets that term from being called the wanderer, because this nerve, it's everywhere. Okay. Yes, it's a cranial nerve, but we also have it. It goes through the larynx. So it innervates and is through so your vocal folds, all of these areas, and then it goes down around the heart, like it literally wraps around it, and then it goes through to the gut. And this is, if you'll be like, I feel butterflies in my stomach, I feel nervous. A lot of that is the vagus nerve, is that signaling that you're getting. So and the vagus nerve, one way that we can stimulate it is through this input to the larynx. So you're, from a muscle standpoint, helping to reduce tension in your throat. And then from a nervous system standpoint, you're helping yourself relax with this input to the vagus nerve. And then there's also, we didn't even get into this, the lymphatic flow that we're supporting. So especially, can we jump there?
Yes.
Can we go to lymphatics? Okay.
Let's talk about lymph. Yeah.
Yes. Let's do it. Okay. I just want to say shout out to Amelia Dewey, the lymph therapist. We miss her dearly, and she taught me so much. And if you guys can still follow her page on Instagram, she has incredible insights and information there. So this is...
we can link it in the show notes.
Yes. This is a shout out to Amelia. Okay. So what I want you to do... Well, first, let's talk about the lymph system. Okay, so the lymph system is basically our drainage throughout the body. So we have, we tend to think of toxins that we release through elimination. We sweat toxins out, but we also really need to mobilize toxins in that lymphatic system that is right underneath the skin. And we have lymphatics throughout. So you have different layers. And this is where it's so wonderful to see a lymph therapist or do something like the Flow Presso, which is feels really good. It's a full body lymphatic drainage. But when we are giving just manual input to the skin under the chin, right here along the neck, this is a gentle way to move the lymph fluid that can get congested when we're sick, that gets stuck underneath or in these lymph nodes. So when you have a cold, this is going to be a time you might feel like under your throat, these lumps. If you go to the doctor and you're sick, that's one of the first things they're going to do. They're going to reach up and feel, well, they should, and feel, do you have stuff stuck in your lymph nodes? And often they're going to prescribe some kind of medication, but they do feel that to see, okay, is this really congested? That can give them an indication of kind of what you're fighting and what's going on. So we have lymph nodes cervically, we have them in our face, you have them behind your ears. So actually, after we complete this podcast, we should do a little lymph massage behind our ears, because we're putting a little bit of pressure on them, and that does congest facial drainage. So You have lymph nodes all throughout your body. I love Dr. Perry Nicholson. He has the Big Six. You can follow, like on YouTube. He shows you different lymphatic things you can do at home. A great time to do it is in the shower, especially because lymph fluid moves the most when it's warm. So if you're cold, it's not going to move as easy because it is this fluid and it'll get thick and it's more viscous. So when we're warm, that's a great time. So if you're in the sauna, if you're in the shower, that's a great time to do a lymph massage. So let me stop talking about it. Oh yes, well, yeah. Let me share that. Sorry. Okay. Yeah. So one thing that's really important to note is that lymph fluid, well, like our blood is pumped by the heart and it's going to move up and down. All of that is amazing. The lymph doesn't move that way. The lymph is mobilized through muscle movement, through us walking, through us actually moving. This is in part why I'm always like, play outside, get outside, because it's dynamic movement and makes you move your body in a way that if you're just static and seated, and even if you're just walking upright, you don't move it as much. So movement is what moves the lymph fluid. So dry brushing is such a fabulous activity that you can do to help support detoxification and your immune system. But let's jump into the cervical lymph massage. So what I want you to do is take your hand and you're going to flatten your fingers. And it shouldn't be a pushing in, because if we push in, that's really going to compress all of those lymph fibers. It's a little pathway. So think of them. I mean, if you look at like a hair, you pull a hair out, that's what we're dealing with. Even thinner than that. That's going to be a lymph pathway. Okay. So it does not take a lot of pressure to compress that. Yes. Okay. So, ladies, real quick, if your bra is squishing your body, if it is too tight, you are compressing your lymph flow, and it's very important. In the breasts and the armpits, we have a lot of lymph fluid that we should be moving through there. So now that you know how tiny these pathways are, it's like, aha, it helps to understand why having a bra that is not too compressive is very important, because we want that lymph fluid to be moving, especially with the breast tissue that is such a house of this lymph fluid. And we want to decrease our risk of breast cancer, because if you're not moving those toxins out, then you're going to be increasing your risk. And we don't want to do that. So let that move. And then, of course, if you're like, well, right now I don't have the budget to go buy a bunch of new bras and we don't want to just go braless yet, then, you know, maybe not, maybe you do. Love that. But if you're not there, then what you can do is actually incorporate Dr. Perry's, like, the Big Six, or you can be doing the dry brushing at home to help with that lymphatic fluid. Okay. I promise we're going to get up to the cervical lymph. So what I want you to do is flatten your fingers. Okay. So it's more of like a palm and finger movement. And again, if you can at some point jump on and watch this one on YouTube, it'll be really beneficial.
So just like right underneath your jaw?
Yes. So under your jaw, basically go back to, so you're connecting with your neck. So my fingers and my palm are at an angle. And I'll just walk through this one really quick because I think people do need to see it. And if you're driving, you're like, I can't see this right now. It's okay. We'll move through it pretty quick. But what you're going to do is just go back and down and then forward again, because the lymph nodes, they're kind of like in a triangle back here. And so we want to stimulate all of them and open them up. And we bring them back down.
So like right again, at the corner of your jaw and on your neck is where you're rubbing. Yeah.
Yes. So I'm going back here and down. And this is something I love to show families when they're like, my child has huge tonsils and adenoids, and we're working on trying to avoid a surgery. Like, what else can we do? I love teaching families how to do this at home. A great time to do it is right before bed. Kids are very calmed by it. Of course, check with your child. If they get stimulated by it, then plan on that. Don't do it right before bed. And instead, you're going to run around. You're going to do it with them, like, during the day. You can also do some kinesiotaping, and that is, you can drain it. So basically, you insert that kinesiotape like right under the jaw, and you're going to pull. And I don't recommend you do this for your kids. Okay, it would be great to see a therapist. You just don't want them to have like a response to that tape. But as an adult, you can see like, Is
Have you
it
tried?
draining? Does it feel good? And it's light. Again, the lymph
Mm-hmm.
nodes, it doesn't take a lot of input. You can just go ahead and put that kinesio tape on. That can help. Or like I said, the Flow Presso.
Mm-hmm.
We'll do a link to them in show notes.
Yeah.
It's a fabulous lymph whole body suit that you like get in and then you just chill out, and it's like a nap for sure.
Yeah.
Even if you don't sleep, you feel so good.
And
Okay.
they also have a little wand as well, which I have, which
Yes,
is
the
so
Flow
helpful.
Vibrate. It's fabulous. It's
It
amazing.
really
So
is.
I'll have to do I just have to do
Some
an
videos.
episode on that. Okay.
Yeah.
So let's
Okay.
move on. Let's take a moment to talk about one of my absolute favorite tools for supporting health and wellness at home: ozone therapy. You know I'm a huge fan of finding effective, science-backed ways to support our body's natural immune defense system. That's why I've been using the Stratus 3.0 ozone generator from Simply O3 for years. Whether it's tackling ear and sinus issues or boosting overall health, incorporating ozone therapy at home has made it so much easier for my family to overcome illnesses and proactively defend against sickness at school. As a busy mom and business owner, I love that I can support my immune health without needing to run to a clinic. And let's be honest, most of the time when my kids get sick, it tends to be at night when clinics are closed anyways. Simply O3 makes it incredibly accessible to bring the power of ozone therapy into your home. Their equipment is easy to use and designed with safety in mind. And because you're part of the biohacker community, Simply O3 is offering 10% off your purchase when you use the code MYOHACKER. Just head on over to simplyo3.com to check out their ozone generators and supplies and use the code MYOHACKER at checkout.
All right, so sore throats, top tips for sore throats. For me, I feel like gargling salt water is really helpful. Mouth tape at night, because I feel like that helps especially if I'm a little congested. Sometimes I'm sleeping with my mouth open, I'm sure. And so the mouth tape really helps to get me over, if I'm starting to get a cold, it will help to kind of eliminate that sore throat. So any other suggestions you have for sore throats?
So lots, but we're focused. Well, actually, let's talk about mouth taping real quick.
Right.
And okay, so mouth taping, if you're listening to this and you're like, I'm going to turn it off now because I hate mouth taping and people always talk about it and it's terrible, hang on. This is for you. Okay? So mouth taping is something that can be an amazing tool, but I do think it is over prescribed, and then people are like I said, they have a horrible experience with it. I want to validate, yes, you had a horrible experience with it because of a specific reason or reasons, and that is valid. So let's talk about why someone might have a negative experience with mouth tape. Okay, if you do not have enough room in your mouth for your tongue to rest out of your airway, what is your airway? That's going to be the back of your throat. Okay. That's ultimately, we should be able to have easy passage of air through the nose, down the back of the throat, and down. Just keep going down. But if it gets stuck because the tongue is dropping back in that airway space and limiting how much space we have there, and then we have muscles that are basically lining the back of the spine so that those posterior pharyngeal constrictors, or these muscles, they'll start to collapse in. If that blocks your airway, well, guess what? You don't sleep because you've got to breathe, or you don't breathe. So neither one of those options is a good one. So what can happen is people put mouth tape on and maybe they tolerate it for a little bit, but then if they start feeling claustrophobic, all of these feelings, that tells me, okay, it's really hard for them to breathe through their nose. So a couple of things to try. One would be, see a myofunctional therapist, because you want to work on that tongue placement and tongue tone. So even if your tongue and it doesn't fit in your palate, because for a lot of reasons that might be the case, and let's say it doesn't fit but you're like, well, is there anything I can do? You can actually change the tone of your tongue. And so when you work on these exercises, this coordination, it does change whether it's like a floppy tone or if it's tightened and strengthened. And that will actually reduce how much space it's taking up, and that gives you a little bit more airway space. Something else is going to be, can you change your position? If you could sleep on your side, that can help a little bit, because instead of it dropping back and into your airway, now it's, gravity's pulling it more to the side. So you might tolerate it differently. So that's often a thing. People are like, I have to sleep on my back. I cannot sleep on my side. And then they can't tolerate the mouth tape. And I understand that. So then thankfully I get to work with those patients in person, and we get to troubleshoot through that. Something else you can do, breathe right strips. So that gives you a little, and there are different types of nasal dilators as well. There's mute, which is a nasal dilator that you actually stick up in your nose, and it opens the nares or the nostrils. And when you have that, that does support nasal breathing. So all of those things, kids are going to tolerate, for the most part, breathe right strips easier, but definitely put it on for them. Like, you play with that, let them do it. And it's so funny. My oldest, he will ask, he'll be like, Mom, I need breathe right strips tonight. Can you put them on my nose? Like, they'll start to advocate for themselves and be like, I'm having a hard time breathing through my nose. That's what we want. That's an amazing thing. So if you're having difficulty
with his body like that, that's so amazing. That
he is now.
But you've trained that into them. And I think that's such a good thing to work with your kids on, of, being aware of if they're having trouble breathing, that's so amazing.
For the most part, kids are in tune. It's, as adults, we start to shut this off.
Right.
And just in and in our society, we just don't have space for this. So I love to, it's so inconvenient, guys, but I love to create space for my kids to feel and tune in. And it can be, well, I don't want to go off on this too much, but I'll just say it can be kind of traumatic as an adult to tune back into your body, because we have shut it off for so long, just because we just have. And I love that kids haven't learned that yet. So they'll tell you, they'll be like, they know what they're feeling.
Right.
They maybe don't articulate it in a way that I would consider articulating it, but they are feeling things, and it can be amazing. So I do love teaching that. Okay. So if you've had a negative experience with mouth taping, reach out to me. I actually think we should do like a deep dive episode on this. And I want to do sort of like, if this was your experience with mouth taping, if this was your experience, like we should make a quiz of it. Like, this was mine, and how long were you able to wear it?
Right. I know some of the mouth tape, like the ones you buy, they go all the way across the lips. And for me, I just do one little, like I cut a piece of, I think it's like sports tape, and just do a little piece. I feel like that makes me feel less claustrophobic to have. Because it's like I can still breathe through. Like, if I needed to, I still could breathe through the sides of my mouth. And if my kids need to talk to me, I can like talk to them a little bit.
Yes, absolutely. I mean, and that is actually something I love that we now have a variety of mouth tape options, because you can just do the micropore tape and you stick that over your lips, and then, which is going to be like your cheapest option. You can do, like you mentioned, some kinesio tape, and you cut a little strip and you just put it in the middle. You can do, guys, the only things, don't do duct tape. Okay. You should be able, I have to say this.
Not a good option.
People do this.
Yes.
Walk away and say, Karindy said, don't do duct tape. Okay. Don't. What I want, VIO2 tape is a great option. I need to be modeling all these because they're fabulous. That's one that I do like, but guys, you might need to shop around and try a couple of mouth tape options.
Okay. So sore throats. So gargling, mouth tape, what else and the lymph massage, was it the cervical massage? Is that what she said? So what else for sore throats?
So many things for sore throats that we can continue doing. Okay, so sore throats also, is it paired with like an ear closure? Is your eustachian tube not draining? That is something that go in and see a chiropractor, and they can do an adjustment. If they're like, I don't know what you're talking about, see a different chiropractor. They don't
Yes.
have the training for it. Okay. This should be something that call ahead and see, like, are they doing these adjustments? And you want, like, you're going to want the crunchy chiropractor, not the one that's more mainstream, maybe.
Right.
Because you want that adjustment to get the eustachian tube to open. That can be a reason, like, you're just getting this drainage that is not clearing, and you want to thin that out. So that is something, do pay attention to your ears in relationship to pain in the throat. Okay. You can also do aural insufflation, which that's AURAL. So aural as in the ears. And that is, you go in and you can find someone that's providing ozone, where you place that in and you wear, it's like a stethoscope in your ears, and that can help with infection or anything that is, if you've got a head cold, a sinus infection, things like that, helping the body to generate its own protection against these bad guys and clear it out. So I love doing that. If you're super sick, that's when you want to go look in more of the EBU. We'll put that in the show notes. It's an amazing full body experience if you want to really clear things out. But for the most part, if you're like, it's just a head cold, I've got this, ozone can really boost your immunity there, and you want to support it in that way. Something else is going to be red light. So I know a lot of people now have red light. So putting that red light again on your lymph nodes, that can be very supportive. Doing, like we had talked about, the colloidal silver. I like to get the one that's the spray, especially for kids, that's the spray for the nose, and you actually shoot it in the back. So you can get further, especially if those tonsils and adenoids are enlarged.
Okay, so in the mouth?
Yes. So you aim it in the mouth, and you get it on those tonsils and adenoids just topically to actually support that. That can be very beneficial. And then, but again, you don't want to do too much. Like I said, I know that colloidal silver, some people talk about, it being negative and all of these other things. I've just seen clinically that it does help reduce that tonsil size. So that can be beneficial. And then I know castor oil packs. So supporting the liver, we haven't talked about the liver much in this because we're talking about airway stuff, which we're going to focus on. But sometimes we need more of a systemic support, and we might need to support that detoxification of and clearing things in the liver. So also Bliss probiotics, I do love their strep strain. And now I know that others are providing that as well. If, let's say, the sore throat you suspect is due to strep, that can be something that you really support against. Then for the Bliss probiotics or any of these dental probiotics, really what you want to do is you brush your teeth, floss, do all that. Then you place it in your mouth and you suck on it before you go to sleep, because you don't want to be rinsing it out. You want it to populate all of those good guys in the back of the throat, in the mouth. So you'll get different strains. And when I talk about the strep, it's because they've actually created beneficial strains of it, because they'll see, okay, the kids, it was created in Australia by a researcher who had tons, like so many strep experiences as a kid. I mean, it's pretty tragic, but again, guys, your story counts.
Right.
There's a reason for it. He now created this strain because they followed all of these children through elementary school into the high school. And they saw, okay, the kids that had this strain of strep, they didn't know if it was good or bad, but this strain of strep, they didn't end up getting like the symptomatic negative side effects of quote unquote the bad strep. So he created that. So guys, I'm not selling Bliss probiotics. I just love that there is now a strep solution that you can protect against, because as we know, we can get neuroinflammation if we get strep. So it is beneficial to go and see a provider if you're like, we're getting sicker, to find somebody, because we just don't want to have this whole systemic effect that can occur. So having your team on board and finding those providers who understand your perspective before you get sick is so beneficial, because then if you do need them you can find some solutions like that can be really supportive. So something else, people will often talk about throat issues, but you can actually have these bad bugs that are living in the nasopharynx or in the nose. And so this is where the xylitol spray is so beneficial, because so we clear the nasopharynx or the nasal passages with saline, and then we follow it up with the xylitol spray, or the X-Clear is the most marketed, but there are other ones too. You can make it at home too. You just get a bunch of xylitol, make sure it's a clean brand, but xylitol, and then you put it in a warm saline water, and you then are able to get that xylitol to stick to the lining of the nose. And when that happens, then these irritants, these bad guys, they are not able to adhere and cause more of a problem. And I know Dr. Krubstadt over at Hope for Healing, which is an amazing clinic here in the Houston area, she has talked about that they see that the xylitol actually breaks up the biofilms. So sometimes, I do want to warn against this. You might see, usually it's after about 2 weeks, sometimes sooner, but usually it's about 2 weeks that people are using the xylitol spray, that their kid suddenly has like a ton of drainage. They might get kind of a flu-like symptom, like they can get sick. That can be a time to consider taking like an activated charcoal, or, sometimes you can open the capsules and you put it in applesauce and you'll call it black applesauce, and, or make it something fun that right. Your kids are like, that looks weird. Let's make it fun, make it spacey, whatever, right. And then they'll tolerate it because they might need some of that support to bind things if they've opened up biofilms in their body, and you actually need to help clear that. Uh-huh. So that is an excellent resource as well, is just to be aware of like clearing the nose when you're having these symptomatic issues in the throat. Uh-huh. You can really help with that. So we should wrap it up.
Yes.
I could keep going. Hang on. We got to talk about sunshine, even if you feel terrible and even if it's cold outside. I want you getting outside in the sun and getting that sunshine. It is just so important. And sleep. I want to give you just that emotional permission to rest, okay? To sleep, to be like, I actually think I need 12 hours of sleep today. You probably do, all right? And as busy moms, that's not going to happen. But maybe you can speak up for yourself a little bit more about different things, ways that you need support and help to get more rest, even if it isn't quote unquote sleep.
Mm-hmm. Yeah, just some horizontal time, or take a nap if you can. Yeah.
Yes. Naps are so good. Or non-sleep deep rest. You can find tons of resources on YouTube about these, and check those out. That's a really great way to support your body. Oh, and I talk about this, I think, all the time, but getting outside barefoot, so good. Just let's get that negative ion exchange and shift things. And then, of course, sauna, sweating, getting in a hot bath. You don't have to have a sauna, okay? You can just get in a super hot bath and get that out and move your body even when you don't feel good, if for no other reason, because it supports your lymphatics. When you're walking, when you're moving, if you can jump, that's great. If you can do all these things, it moves and clears toxins out. All right, we'll stop there. Yes.
So many good things. So we'll have to come back and talk more about other things, because allergies and all of the other health things, but we'll put stuff in the show notes. And yes, I'm so excited because you have so many good suggestions that have really helped my family a lot.
I hope you enjoyed this episode of the Biohacker podcast. Remember, small changes can have big impacts on our overall health and well-being. If you enjoyed this episode, please take a moment to rate and review the show wherever you get your podcasts so more people can learn about the show. Head on over to myohackerslp.com for in-depth resources, free guides, and access to my online courses. You can also join the fun on Instagram at myohackerslp for bonus content and updates. And if you have questions or topic suggestions for future episodes, please send me a message. I would love to hear from you. Until next time, let's biohack myofunctional health as myohackers who change the world through intentional action and connection. Quick disclaimer. The content shared in this podcast is for informational and entertainment purposes only. The views and opinions expressed by the host and guests do not necessarily reflect those of the podcast or its affiliates. This podcast does not provide medical, legal, or professional advice. Always consult with appropriate professionals regarding your individual circumstances. By listening, you agree that the host and podcast are not responsible for any actions you may take based on the information provided. We encourage critical thinking and urge listeners to verify any claims or statements made during the show. Your mental and physical well-being are important to us, so please listen responsibly and prioritize your health and safety. Thank you again, and biohack on.